Guidelines in performing passive range of motion exercises. First, ensure that the client understands the reason of doing range of motion exercises. Second, if there is a possibility of hand swelling, make sure that all of the rings are removed. Third, clothe the client with a loose gown and cover the body with a bath blanket. Fourth, use correct body mechanics when performing range of motion exercises to avoid muscle strain or injury to both yourself and the client. Fifth, position the bed at an appropriate height. 6. Expose only the limbs being exercised to avoid embarrassing the client and to maintain warmth. 7. Support the limbs above and below the joint. This is to avoid muscle strain or injury. This may also be done by cupping the joints in the palm of their hands or by cradling the limbs on your forearms. If the joints are painful, this may also be done by supporting the muscular areas above and below the joint. 8. Use firm and comfortable grip when supporting the limbs. 9. Move the body parts smoothly, slowly, and rhythmically. Jerky movements can cause discomfort or pain and possibly injury. And fast movements can cause rigidity or spasticity. 10th, avoid moving or forcing the body to extend beyond the existing range of motion. This may cause muscle strain, pain, or injury. This is particularly important among people or clients with flaccid or limb paralysis whose muscles can be stretched or joints dislocated without their awareness. 11th, if spasticity occurs, stop the movement temporarily. Apply firm, apply slow. If muscle spasticity occurs, stop the movement temporarily. Apply slow, firm pressure on that part until the muscle relaxes. Then continue the movement. If muscle spasticity occurs, stop the movement If muscle spasticity occurs, stop the movement temporarily. Apply slow, firm pressure on that part until the muscle relaxes. Then continue the movement. 12. If rigidity occurs, apply slow, gentle pressure on the rigidity. If contractions are present, apply slow, firm. If a contraction is present, apply slow, gentle pressure. If a contraction is present, apply slow, gentle pressure without causing any pain until to stretch all the muscle fibers. If a contraction occurs, apply slow, gentle pressure without causing any pain to stretch all the muscle fibers. If a rigidity occurs, apply pressure on the rigidity and continue the exercise slowly. If rigidity occurs, apply firm pressure on the rigidity and slowly continue the exercise. If a rigidity occurs, apply a firm pressure On that, if rigidity occurs, apply firm pressure on the rigidity and continue the exercise slowly. 14. Teach the client's caregivers the purpose and the techniques of range of motion exercises at home if applicable. 15. 15. Avoid hyperextension of joints among older clients who are arthritic. And lastly, use the exercises as an opportunity to assess skin condition.